Good afternoon, and thanks for joining us for this special edition of the Adventist Health Bakersfield Wellness Connection. I'm Kiyoshi Tamano, coming to you live from the 23 ABC studios. And joining me today to talk about something that is, I think, on everyone's mind. We're talking coronavirus, also known as COVID-19, which is the actual name of the virus, or the disease, I would say. To talk a little bit about the latest on what we know right now and what you should be doing at home if you're watching this is Dr. Ronald Reynoso, who is our Chief Medical Officer at Adventist Health Bakersfield and Adventist Health Tehachapi. So thanks for joining us.
Thank you for having me, Kiyoshi.
I can tell you guys have been tired, right? You've been working a lot of hard hours, and a lot of folks, we've been talking and coordinating with public health a little bit about this, and I'm touching my nose, which I realize, right, I'm probably not supposed to do. And the other thing I want to note here at the top of the show is we've got hand sanitizer, and we're sitting the social distance at least 6 feet away from each other so that if there were any airborne droplets, if I were sick, right, or you were sick and vice versa, we wouldn't be getting each other sick, which is important to do. So we want to thank you guys all for joining us here on Facebook Live with 23 ABC, and we're going to be taking some of your questions to the best of our ability. Of course, there are some questions that have to do with school districts, things that have to do with public health that pertain to some of the testing that we're not able to answer because we don't have that information, but medical questions about how this disease spreads and how it's basically dealt with in the healthcare setting we can talk about today. And Dr. Reynoso, your training is an internist, right, an internal medicine doctor with a focus on hospitals, right, as a hospitalist.
Yes, that's correct.
So I think we're going to get to some of the questions that people have already been asking, which is one of the basics. Let's start with that basic question, which is, what is the coronavirus? And why are we talking about it now as opposed to last year we weren't talking about it?
Yes, the coronavirus, and specifically the COVID-19, is a new type of virus. It's member of the coronavirus family. Corona means crown, and the name comes because the virus has spikes on the outside that resembles a crown.
Okay.
We have some of those that we have had for many years, but this one in particular is new. That's what they call it, the novel, which means new.
Because and I've been looking at the Facebook feeds like everyone else. That's how we get our news these days, right? And you're looking at this information as we're talking about it. It's been closely monitored by public health officials. So human coronaviruses were first identified back in the 1960s, which is why when you see that Facebook feed, everyone's talking about how when you look at the back of the Lysol, wipes canister, it talks about coronavirus and how it kills coronavirus. And people are saying, well, coronavirus was around for a long time. That's true, right?
Yes,
but this particular strain is what we're concerned about.
Yes, this particular strain is totally new for, at least for us. But yes, we have other types. And if you remember years ago, we had two other public scare, if you want to call it, where the MERS and the SARS were happening across the world, and those were coronaviruses, but they were limited on the spread. And
so what's so different about this one, and why are people so much more, and why are public health officials so concerned about this one? Why is it just being new, short of it being new, what is so different about this one?
Well, by being new, we don't know much about it, obviously. But what is concern is that it has spread beyond what the others have, and it's now obviously become a pandemic, which means in so many countries, and also what has made people worry, not necessarily scared, but on the medical field is the way it takes, and for certain segment of the population becomes a real problem. But that's why it's been a concern for everybody.
Because it's particularly virulent. I mean, one of the questions, right, when it comes to infectious diseases and things that you see in the hospital and in the community, when we talk about community-based infections, is people are like, well, isn't this just the flu? But this is something different, right?
Yes, it's different than the flu. It's still a virus, but it's different. We have a lot of information coming. Obviously, but by being so new, you cannot have complete clarity. But for a certain specific segment of the population, especially the elderly, it can be a real problem. Not necessarily that everybody will have it, at least the problems or the respiratory problems. But that's what is the bigger concern from the medical field.
So how is coronavirus spread? That's one of the main questions. Can I get it by touching a surface? Can I get it from shaking hands? Because there's all these precautions in place. How am I going to get this if I'm going to get in contact with it?
Yes, again, what we know so far, and things change on a regular basis, is that mostly it's droplets, but also it can get into surfaces. Like metal is one of the ones that it tends to leave the longer.
Because it's non-porous, it doesn't sink into the surface, it just sits on the surface.
And then other surfaces like clothing and things like the table. So, but the primary contact is by air droplets. So that's why we are recommending these social distances.
So not coughing on each other, not sneezing on each other. But the other thing is sneezing on the table, and then I put my hand on the table, and then I rub my eye, or like I was doing at the very beginning of this, this feed on Facebook is rubbing my eye, because then I'm rubbing the virus into my eye, which is a mucous membrane, which is going to basically be the window for it to get in my body, right?
Exactly. I mean, contact with a surface that might be contaminated is a problem. And that's what you see the recommendations out there, that don't touch your face, don't touch your nose or your eyes, because then you can contaminate yourself by not knowing it.
Because you can't. This is a microscopic organism. You can't see it.
You're not going to be able to see it.
Right. So, and the incubation period is 14 days on this. So you're not going to necessarily feel bad immediately.
Yes. I mean, what we know is 14 days is what we have based on evidence. Some people might have a shorter one, but if you do the average, is 14 days. And usually, or the majority of the people don't have symptoms, and that's why we're telling the population that it is important to follow the recommendations of the isolation and the distances, because you could be a carrier of the virus and not know it. So, and that's what is tricky about it.
And that's what's frightening and I mean, as we were talking about about the virulence of it, if you're younger, you may not necessarily have severe symptoms, but you can pass it on to somebody else whose immune system is not so great.
Exactly.
Somebody that's elderly, that's in their 80s, and that person's not going to be able to fight it off.
Yes.
So let's talk about that, because that is the big question here. Just this week, basically, and over the weekend, you saw a slew of new closures coming down. The governor of the state of California down in Los Angeles, it became an executive order where they were closing bars, nightclubs, limiting seating in restaurants. Some of the restaurants have now voluntarily closed their shop. Gyms are all closing. Schools are now closing. Why are they doing all this? This is unprecedented territory that I think we're in, and that's why people are kind of buying rolls and rolls of toilet paper, because they don't know what to do with themselves, right? They're seeing all this stuff happening, and they're like, What is going on? Let's talk about that. So what does closing everything down have to do with keeping the virus from spreading?
Yeah, so what we're trying is to prevent the spread. You have seen that out there. They call it flattening the curve. So it's the curve of the spread. And why we're doing that is we're learning from what happened in other countries and seeing the example of Korea versus Europe and Italy, where by doing this type of preventive measure can help you to mitigate the spread and be able to have the resources that you need to treat the population.
And that's what we're looking at, this graphic on the screen right now, is the orange is what happens when you don't do anything. It's a very steep curve, and that dotted line is the healthcare system capacity, which I know we want to get into in a little bit, but basically there's only so many beds at hospitals, right? We are a 254 bed hospital. Different hospitals throughout our county have different capacities of how many beds they have, but there's a finite number of hospital beds. And if 1,000 or 5,000 people all get sick at once, there's not enough beds to treat people.
That's correct, and that's why we make the emphasis on prevention. You have limited resources, not only beds, but medical personnel and equipment and everything. So you try to be good stewards of those resources. And the best weapon to treat any condition, coronavirus, flu, whatever, is prevention. So we're trying to prevent the population to get on that spike so we can manage it better.
Yeah, because as you saw, if you do those certain things that we've been talking about, and you've heard public health been talking about for the last couple of days, social distancing, which is the new word of like staying away from people, hand sanitizing, right? Washing your hands even better, because the hand sanitizer will kill things, but if your hands are visibly soiled, you're supposed to, which we're going to talk about, is washing your hands appropriately, and just not congregating in groups of people where you're potentially going to sneeze and cough on each other, right? Those things will help keep the 5,000 cases to maybe come down to maybe 300 cases, or spread those 5,000 cases over a longer period of time, which gives the healthcare system time to react and manage it, right?
Exactly, and that's what we want to have. Obviously, the less cases, the better. So we want to spread the curve as much as we can to prevent our resources to be strength and also, or stretch is the word, and also to have less sick people. So that's the purpose of flattening the curve.
And it's an interesting thing, right? Because I've seen a lot of the memes going around as well, which suggest this, which if we do everything right and everything goes our way, we may in a couple of weeks be kind of like, what happened? Nothing happened, which is exactly the point, right?
Exactly. We want to be like that. It would be better that we say, well, we did have very minimal cases and we did really well, than having to go through Italy's going right now.
Which is what's happening. I mean, what is happening in Italy? From what I've read from the newspapers and from the news reports, they're having to make some tough decisions there, where there aren't enough ventilators to go around. Is that right?
Yes, I mean, they're having to make very tough decisions because their resources are being stretched really thin. So they have to make triages on how to treat people and how to utilize their resources the best way possible. And I mean, it's frightening, but at the same way, if you plan it and you work like we're trying to do with coordination of public health and the government entities, that's what we're trying to prevent. And you have a good example if you look at South Korea, that they have been able to test a lot of people and not have that many cases, at least severe cases in the hospital. So that's what we're trying to work on.
Which is what it's both frightening people, but I mean, to me at least, it's reassuring that we're doing something, and we know, because there are other examples like Singapore, some other countries that have been doing these far stricter measures that have seen success with this. There are successful models that we're trying to follow.
Yes.
So it's not like we're just guessing at this.
Yeah, the key is not to be frightened or fearful. It's just to be minded and think on preventing measures. You know, this is a preventive process that will get us to a better place.
Great, and then we do appreciate you guys. I know that you guys are out there kind of asking some questions. We're going to try to get to some of those here as we get through the Facebook feed. I'm monitoring them as we go along. Question, so who gets impacted the most by coronavirus and why? Do we know fully yet?
Well, what we know so far, and again, things are changing on a regular basis, is that the segment of the population that get hit harder is the elderly. 65 and above seems to be the ones that have the more tendency of needing medical care in the hospitals, and the ones that are driving the mortality. But you know, we can have people on all the ranges, but the majority are on that range. So
what about pregnant women? Because that was a question. I remember, you know, not too long ago, 5-7 years ago, my wife was pregnant, and they were telling her this is an immunocompromised situation because you've got a baby and your body's suppressing its immune system because the baby's growing inside of you. So are women who are pregnant more likely to get it?
Well, so far we don't have much evidence of how this is affecting the pregnancy and the baby. You know, the best way to approach this is, as a pregnant woman, is to get the same prevention they will take with anything else. And using all these measures that we're telling the population to do. But we don't have a lot of concrete information to say which way or the other. As time's gone by, we'll be able to give more specific guidance.
So if you are a higher risk, like you were talking about the elderly, what do they need to do? Preventative measures include large crowds, don't touch your face, eyes, or nose. What are the other things? Washing your hands with soap and water?
Yeah, the first one is what you mentioned, soap and water, and doing it every time you either touch surfaces or you know, have not washed them in a timely period. But avoiding the large crowds is one of the best things that you can do. Also, if you have any sick person in your house, limiting the exposure to that person. Also not touching your face, ears and nose. And using hand sanitizer if you don't have the soap and water around you, those are the best things that you can do to prevent this.
So this is a hot button topic because everyone's been talking about it, and we've seen cases now in the news of people hoarding masks and hand sanitizers. Is it recommended for people to wear those masks, the surgical masks that people seem to be having, or gloves if they're leaving their house and going out in the public?
So far, the recommendation from CDC and from Public Health, you see that they are saying no. And there are multiple reasons for that. One is that for the mask, you need to know how to use them and dispose them, because otherwise you can be contaminating yourself and others. The same with the gloves. That's why they are saying, if the best way, based on evidence, is that you wash your hands or either use a hand sanitizer. And the other reason for that is that people are hoarding the supplies that are needed and for the hospitals and clinic, and then you are taking away a resource for the people who really need it. So the recommendation is those are not things that you should be using.
It's not going to be, as far as we know right now, effective in keeping you healthier or safer.
Yes.
Okay. Will warm weather stop this outbreak of COVID-19? There's been a lot of discussion about that, especially at the very beginning. They're thinking, well, isn't that the way it works with flu, right? We've got the flu season. It goes away when it gets warmer outside. Does it kill the virus? Is that going to happen with COVID-19?
Realistically, we don't know. We're hoping that it mimics what other viruses do, and that the warm weather can cause a decrease in this, or make it go away. But we don't know yet. We are waiting to see more reports, because now that it's across the world, and we have it on the tropical areas, how that is, how it is behaving, and that will be reassuring to see if in the coming months this is going to go away.
So do we get, I think I saw on NBC and ABC News stories that indicated that they are coming up with a vaccine. How long is that going to take? Are we going to have one of the shots like we do for the flu shot, like anytime soon, or anytime it'll be effective for us?
Well, yes, we are working on vaccines here in the U.S. I think we started this week. Europe has been working on that, I think, over the last several weeks. Mm-hmm. It's going to take a little bit of a time. We think that within a year we might have an effective vaccine that we can use. And in a way, yes, it's going to be something like when we treat the flu, that we are going to ask the population to get it in order to prevent the spread and the consequence of it. But that's what we know right now.
Right now, we're not there yet.
Yeah, we're not there yet, but we're working on it as a nation, I will say, and in other nations as well.
So let's ask the all-important question, because I had a friend text me earlier today. He said, I've had a stuffy nose, kind of runny, not been feeling great. Is this it? Is this it? Should I get my affairs in order? Do I have COVID-19? How do you know you have the COVID-19 virus versus the flu virus versus a cold? What's the differentiator between those things?
I mean, on symptom-wise, what we have, based on the evidence that we have, mm-hmm. is that dry cough is one of the symptoms, the shortness of breath, the fever. There are other symptoms that sometimes cross with the flu, mm-hmm. but this one doesn't seem to have those ones of the runny nose and congestion like the flu has. The flu has more of a body aches, severe body aches, and hits you really fast. This one doesn't seem to act like this, mm-hmm. But some of those symptoms can. If you look at them, that might be similar, but the three biggest ones are that dry cough, the shortness of breath, and the high fever. And then when you associate those with possible exposure or travel, that's what gives you the kind of the red flag of, you need to ask for guidance.
Which we just should note, the first case, the Public Health Department is the kind of definitive source on this. They're doing all testing and roads kind of go through them, announced the first non-resident person in Kern County has been diagnosed and confirmed with this virus. So it is now in Kern County officially, which I think all of us probably thought, when you look at the trend of what's happening all throughout California, it wasn't like Kern County somehow was going to be immune from this, right?
Yes, we were expecting that one was going to show up mm-hmm. or maybe more. But fortunately, this is just a person who is not a resident, but it is here, and we are all needing to be just prepared.
So when should you seek treatment? If you're at home and you've got those symptoms of say a fever, when do I need to go see a doctor? How do I go see a doctor? Do I go to the ER? What is my decision-making process?
Yes.
Right? If I'm at home, I'm like, do I go to the urgent care? Do I go to the ER? Do I walk in? Is that a bad thing to do? What should I do?
Yes, the best recommendation that we're telling people, either if you have recently traveled or been exposed, is to self-quarantine at home, and then you call your physician. They will guide you what are the steps to do.
Mm-hmm.
We are not recommending to flood the clinics or the ED because some of the time these symptoms might be either a cold or a flu, and you don't want to either expose the patient or expose others. So your primary doctor will be able to guide you what is the next step after they do a series of questions, and then they will take you to where is the right way of testing you if it is necessary. We are recommending that you visit the hospital only when you are really needing that medical care, that you're sick, that you need to be in the hospital. And again, the best way is you talk to your doctor. They will be able to guide you and say, hey, this is the time that you should be in the ER.
And we have a question actually from Donald G. Murphy. He said, why test if there's no cure? You just have to deal with it for a few days. I think I know what you're going to say to this, but it sounds like it could be more than just you have to deal with it for a few days.
Yes, it is more than deal with for a few days, because we don't know the extent of the spread of this disease, how long it's going to be. Knowing that you have it is important, because for once you can self-isolate and not expose others. Mm-hmm. And also, we are working, as we mentioned before, on vaccines. Some other places are working on treatments. There are some clinical trials going on. And there are resources that can be used if you get really sick and need them. Mm-hmm. So it's always important to know, because that will alert and help the medical field to give you the guidance and the help.
So Stephen Minyard asks as well, I would like to know, once you get the coronavirus, how long are you sick with it? Depends, I guess.
It depends. It depends on the individual. What we have seen is a couple of weeks with that. That's what is reported, across, from the evidence coming from China and Europe and even here in the U.S. The majority of the people recover well from this. Just a certain percentage is the one that require more intensive care. Mm-hmm. But it's on the few weeks, like 2 to 3 weeks is the period, but it depends from individual to individual.
Okay. Let's talk about safety measures, something you've been hammering quite a bit here today, and something that people should be doing every day, which I suspect maybe they haven't been, by the surprise and shock I've seen on Facebook, like hand washing, right? It's a new thing. How long should you be washing your hands? And what's the proper technique? You see the surgeons who are in there, scrubbing their hands for, 10 minutes. How long do you really need to be scrubbing your hands, and why is that important?
Yes, it is important because not only for the COVID, but any other diseases like the flu and other bacterial diseases, you can eliminate them from your body and prevent a further infection. The recommendation is that for at least 20 seconds is the minimum time for washing them. If you can do it between that and 40 mm-hmm. seconds is really good. The recommendation is that you try to wash your hands entirely, the front and end part of it and between the fingers, so you can cover the entire hand.
Okay, I'm going to go to another question that we have here from Melissa Cole, who's asking on her live feed, do those who have had other diseases like whooping cough have a greater chance of catching the virus if you've got other respiratory issues or previous history of respiratory issues?
What we know so far is that if you have an underlying respiratory illness like asthma, COPD, you are at greater risk. The fact that you have had any other infectious disease in the past, not necessarily. Mm-hmm. You can have the flu, last year, that's nothing related to that. But other conditions, like you mentioned, asthma and COPD, or chronic lung disease, they can be at more risk with this, and any other viruses, to be quite frankly, like the flu.
And I appreciate a lot of people here are talking back and forth about, beyond just the day-to-day of being worried about getting sick is just being at home with your kids, which I totally fully understand because I've got 2 of them at home right now and trying to balance that with the wife, right? Everyone's going through this. The great thing that I see a lot of on Facebook is the kind of community of people offering to help services. Some churches, I've been talking to CityServe and Robin Robinson over at CityServe and how they're looking at how the churches can help deliver food to people who are shut in, because that's the other part of this, right? If we're going to be able to socially isolate each other, we do have to check in on the elderly, the folks who don't have access, and even some of the stores as well that have been talking about opening up early or setting aside certain hours for the elderly so that they can get access to those things without being in big crowds. Important stuff, right?
Yes, absolutely. I think we need to help each other and give that helping hand to the elderly. Always having these precautions because they are the more vulnerable part of the population, and you don't want them to get exposed. But yes, it's always good to do that for them.
Let me ask another kind of just general question about clinic visits, because I am getting a question on here from, I think it's Michaela, who said, are doctors making house calls? What do we do if we need to go to the dentist? Should we still be going to the dentist? Should we still be going? I know that my pediatrician just sent out an email that said they're kind of doing something interesting where they're rationing the first appointments of the day for sick visits, and then the other afternoon visits, they're probably going to do some kind of terminal cleaning or something in between, and then the well visits in the afternoon. If you were planning on going to get your kids vaccinated, is that stuff still important to do?
Those things are important to do. The best recommendation is that you talk to your provider and ask for guidance, because each clinic, they're trying to take preventive measures, and that feeds their population and their patients. So, what we're doing as a hospital might not fit, a clinic. So the best way is you talk to them, and they will tell you what time is the most convenient thing to do, or if they are deferring or rescheduling an appointment for another day.
Okay, so let's go back to the other. We talked about first with the hand washing. How about hand sanitizer? There's a special procedure for that too, which I learned having started to work in a hospital, right? That you don't just kind of slather a little bit on and move on with your life, right? There's a actual procedure that you're supposed to follow.
Yes, it's kind of very similar to the one of, actually it's the same as washing your hands. The trick with this is, because this is, the alcohol is the effective product that, sanitize your hands, is that you need to wait for it to dry. So between 15 to 30 seconds is a recommendation, but actually what is going to trigger you to make sure that you have done it the right way is once the hand sanitizer has dry on your hands.
Okay. And let's talk a little about the difference, because that was one of the things that I think was really fascinating to me when we started talking in the hospital about C. diff, which is a really difficult bacteria, not related to coronavirus, but it speaks to the need of and the differentiation of when you need to wash your hands versus using hand sanitizer. Because hand sanitizer kills most things, but when you read the jar here, even when you read the front of it, it says 99.99%. So there's some things out there that even when you put the hand gel on, doesn't kill everything, right? Like there's certain bacteria strains and things like that don't get killed, which is why you still need to wash your hands, even if you got hand sanitizer.
Yes, the number one recommendation is wash your hands. If you can't, because there's no access to soap and water, then you do the hand sanitizer. But even that has a limit. We recommend that after you have used it 2 or 3 times that you go back and wash your hands. That's the best way.
Because that's what gets everything off.
Yes.
Okay, and for those of you, again, watching here on Facebook, if you still have questions, Adventist Health has actually set up an advice line to provide information for folks at home about coronavirus. The advice line is actually staffed by an experienced registered nurse to answer your questions about coronavirus or concerns about visiting one of our Adventist Health clinics or one of our hospitals. So you can reach the special coronavirus advice line by calling 844-542-8840. They're going to have a lot of information, general information about the virus and about the Adventist Health facilities and access points for our facilities. They won't have advice for all the different facilities across the state or things like that. But we do want people, and it's available 7 a.m. to 7 p.m. Monday through Friday. So if you have questions about those things, or you're wondering, okay, what, like we were talking about before, if I need to go to see a doctor, how do I do it, or what's the best protocol, they'll be able to kind of walk you through some of these things.
Correct.
Which is just really interesting. Can we? I did want to, and I mentioned this on a Facebook post earlier this week, peel back kind of what people don't get to see of what's actually happening, not only in our facility, our hospital, but in coordination with public health and at hospitals across this county. Can you talk a little bit about that and the preparations that are being, so that people, for me at least, I think it's comforting, right? From a layperson who's non-clinician, I'm not a doctor or not a nurse, it's comforting to know that you guys are planning, that you're not just kind of sitting waiting for this first case to come, right? So there's all kinds of meetings that are taking place to manage the resources.
Absolutely, and we keep in constant communication with our local authorities at the county and also the state level, and we follow the guidance from the federal agencies. So we try to keep very good communication regarding the guidelines, anything that is coming, and so we can always prepare for this. That's the best way and to deal with anything like this. And it's really reassuring even from our side of the equation that we are all talking and doing this for the best of the community.
Yeah, I mean, if I could literally peel back the curtain, there's meetings that are taking place early in the morning at 6 a.m. There's another meeting that happens in the afternoon where everyone in the hospital is coming together saying, how many beds do we have? What are the resources we need? Where are concerned about resources potentially being a problem down the road? Talking to public health, where's the test available? All these things. There is a huge logistical plan that's going on, which to me is comforting to know that people are thinking about this consistently and acting on it on a daily basis. We're not just kind of waiting for something to happen to us. So
yes, absolutely. This is a team effort where we have multiple parts of the hospital working together and working with the community to mitigate the exposure and to address any needs. So it's really reassuring to see that happening. Yes, there's a lot of labor on that, but it's the right thing to do.
Another question from Christina Wooten, and we talked a little bit about underlying conditions. Does heart disease or heart conditions make you more likely to get coronavirus by any means?
It's not that it's more likely to get you coronavirus, is that there's some reports in there that having certain conditions like diabetes, heart disease, asthma, COPD can make if you get sick, it can complicate things, but not necessarily that they will predispose you to having the virus. The persons who can get the coronavirus or any other viruses, the immunocompromised folks. So,
one of the questions we've been getting a lot is, where can I get tested? I know some of the urgent cares have been standing up or in the process of standing up some testing. What is your recommendation? If you're concerned, we talked about the symptoms earlier, shortness of breath, high fever, those things that might be in a history or exposure to somebody who's traveled recently to some of those high-risk areas. What do they do? Because one of the concerns I'm hearing about is people walking in with symptoms potentially contagious, be it the flu, coronavirus, the cold, and walking into a clinic. That's kind of not a desirable state, right?
Yes, and that's why we're recommending that you call your doctor, because they will be able to hear from you about those symptoms, try to tie it all together and give you the best recommendation. Because yes, they will want you to be tested if you need it, but they don't want to put you at risk. Like you mentioned, we are in the middle of a flu season and there are other conditions in there, so you don't want somebody that, because having some symptoms that may be similar, to get to a place and get, exposed to this condition. So the best way is always reach out, get the guidance, and they will tell you where is the best place to be tested if you are needing to be tested.
Okay, and again, I want to let folks know, if you still have questions, again, I want to send you over to the Adventist Health advice line that we have set up for information about the coronavirus in general, right? They don't have every single answer because I don't think anybody can at this possible juncture, right? There's a lot of moving pieces to all of this, but this advice line is staffed by an experienced registered nurse to answer your questions about the coronavirus and concerns about visiting, if you needed to, one of our Adventist Health clinics or hospitals, how we can help coordinate your care, because it's so important, as Dr. Reynoso was just talking about, coordinating your care and getting you in an appropriate way so that if you, in the off chance that you do have coronavirus, we're limiting exposure to potentially other people that might be at the hospital or at the clinics, which is part of the reason why we started by limiting, and as you've seen on our Facebook feed, limiting the number of visitors in our facilities, because again, we're trying to socially distance ourselves. It's the weirdest thing, right? We're human beings. We love to hang out with each other, and Facebook tries to help bring people close together. We're trying to spread people apart now, which is kind of an unusual thing. And I don't know about you, but I was over at Houchin Community Blood Bank earlier today, and it's just odd, right? When you walk into a room now, and your first instinct is to reach out your hand and shake hands, and it's like, well, sorry, it's just in our nature to do those things.
Yes, so. It feels kind of unnatural because we are all kind of raised in the way that you're social and you interact, and shaking hands is normal. But on this moment, the best way is to keep that distance because you don't want to either spread it or get it. So we need to always keep reminding ourselves in the same way, not touching our face and noses and eyes. So those are things that are not natural for us, as human beings. So
I heard some unbelievable statistic of the number of times people actually touch their nose and face during a day, and it's like unbelievably high. You don't even realize you're doing it sometimes, right?
It is because it's almost automatic in a way. But we have to keep reminding ourselves and others, if we can, to try to keep those strategies in hand.
Well, we appreciate it. Again, it's 2:36 here on this Tuesday, and we have enjoyed chatting with you, Dr. Reynoso. And we know there's other questions on this feed. Some of them we cannot answer, right, about school closures and things like that because we don't control those things. But we'll try and answer the rest of your questions here on this feed as we go off our Facebook Live. But thank you so much for joining us here on this Tuesday. These are interesting times, unusual times for all of us. This is not normal for anybody, but I think the overarching kind of conversation that we're seeing from everyone is that we're going to get through this together by cooperating, working together, not panicking, but planning and thinking and using the evidence to get us to where we need to be at the other end of this. Because there are other countries that are slowly starting to emerge from this, and that's where we want to be in a couple of weeks. So
you're correct, Kiyoshin. Thank you for having me today. And I would say the best way is to keep calm and wash your hands.
Keep calm, wash your hands, and carry on.
Yes.
All right, Dr. Reynoso, thank you for joining us, and thanks for you joining us here on this special edition of the Adventist Health Wellness Connection. We'll see you next time.